My name is Denise Pugash, and I'm a radiologist from Vancouver, Canada. Before I start this presentation, I should mention that I am not a neuroradiologist, but I like to understand the anatomy that I'm looking at. If we look at the ISWAG practice guidelines, you can see that not much has changed between 2011 and 2020. All recommended views of the fetal brain are axial. And in this presentation, we're going to review basic anatomy. We're going to compare ultrasound and fetal MRI and focus on development in the late second and third trimesters. Normal brain is hypoechoic on ultrasound, and this is because the parenchyma contains large amounts of fluid. Therefore, to optimize the image, one of the important things that you need to do is increase the gain to see more detail. If you are scanning, the ideal thing to do is to rotate your probe so that you have the probe absolutely parallel to the beam. Then if you twist the probe by 90 degrees, you will get a perfect midline sagittal view. And you can see one here. The bright white flash that you're seeing, which outlines the corpus callosum, is the fault. It is thin like a sheet of paper, and so it's actually very briefly seen as you go from side to side. You can also see, as a landmark, there is a view of the midline sagittal vermis with its primary fissure. And this looks completely echogenic, which tells you that you are in the vermis and not laterally displaced into the cerebellar hemisphere. If you turn your color Doppler on, you can see the branching of the anterior cerebral artery into the pericallosal and the callosal marginal branches. This chart was developed by pathologists who took photos of the fetal brain and reduced the size of later gestational ages to match earlier gestational ages. The reason to do this is to be able to assess sulcation without being biased by the size of the brain. And what you can see from this chart is that it really takes until about 28 to 30 weeks before the brain starts to become complex by the development of sulci and gyri. For the purposes of this presentation, we're going to focus on the late second and third trimesters. As we know, the brain becomes more complex. And certainly after 29 weeks, we're seeing increasing complexity. Of course, it's difficult with ultrasound because with increasing ossification of the fetal skull, we don't have as many acoustic windows and it's difficult to identify fetal anatomy. So if we look at the medial surface of the brain, we can identify a number of structures, including the corpus callosum, the cavum septi pellucidity, the cingulate gyrus, which follows the contours of the corpus callosum from anterior to posterior. We have the septi pellucidity and the fornices. We have the frontal lobe, which is separated from the parietal lobe by the central sulcus, the occipital lobe, the temporal lobe, the third ventricle and aqueduct, as well as the midbrain, in which the aqueduct runs through, the pons, the vermis, the medulla, and the spinal cord. If we look at the ultrasound image, we can see many of the same structures. Again, the corpus callosum, This is the cingulate gyrus all the way around, and you can see the third ventricle here, the midbrain, the pons, the medulla, the vermis. Similarly, on the MRI, there is the parieto-occipital sulcus and the calcarine sulcus, as well as all the other structures that we appreciate on ultrasound. In particular, I want to point out the aqueduct of Sylvius, which you can see as a very narrow space leading from the third ventricle into the fourth ventricle. The midbrain is a structure that is somewhat important. You can see there are two bumps on this portion of the midbrain, which is known as the tectum or roof. These bumps are bilateral and make up of four bumps called the colliculi, which is Latin for little hills. It defines the quadrigeminal plate cistern posterior to that. And the cistern contains important structures such as the vein of Galen, the pineal gland, and if the cavum belli interpositae is expanded, it may go into this space as well. You can see that if there is a mass effect, such as an arachnoid cyst, it may compress the aqueduct and cause hydrocephalus. Looking in the coronal plane is very useful, and we'll take a moment to go from anterior to posterior in the coronal plane with MRI and with ultrasound. This is a slice going through the genu of the corpus callosum, which we can see here. We're anterior to the cavum septi pellucidum. Slightly more posteriorly, we do see the cavum, as well as frontal horns and corpus callosum. The echogenic structures here are the basal ganglia. These are normal. And we have the head of the caudate nucleus indenting the inferior aspect of the frontal horns, which gives them their typical shape. More posteriorly, again, we see the corpus callosum, but we have sylvian fissure development and opercularization or covering of the insula is occurring. We have, again, the caudate nuclei sitting just below the frontal horns and future white matter filling up the space between the cortical plate, which is here, and the germinal matrix of the ventricles. More posteriorly, you can see the corpus callosum, the thalami are splayed, and now we are seeing the pons in the coronal plane. You'll notice that there are little echoes. The pons is more echogenic than other brain structures because of all the fibers that are crossing the midline, which create interfaces. At the level of the occipital horns, we have the calcarine sulci seen bilaterally. And the occipital horns, this is known as the owl's eye view, in which you have no choroid plexus at all. Again, in the coronal plane, I find it easiest to assess the sylvian fissures to look at brain development. At 22 weeks, the sylvian fissure is widely open. The ankles are obtuse. At 24 to 25 weeks, it looks quite square. At 28 weeks, you can see that about 50% is covered by frontal, temporal, and parietal lobes. And at 31 to 32 weeks, there is almost closure or covering up over the insula. At 26 weeks, we can identify the interhemispheric fissure, frontal horns, corpus callosum, the cavum septi pellucidum, the caudate nucleus, which is here, the basal ganglia, sylvian fissures, temporal lobes, and the hippocampus of the temporal lobe, which is the structure which is curving along the medial inferior aspect of the temporal lobe. Hippocampus means horse sea monster, and you can see the tail resembles the hippocampus in the fetal brain. At 28 weeks on fetal MRI, again, we can see similar structures as we do the interhemispheric fissure, the frontal horns, the corpus callosum, and hebum septipellicity, the third ventricle, basal ganglia, the sylvian fissures, the temporal lobe, and the region of the hippocampus in here. We can also see a little bit of the cingulate gyrus and the cingulate gyrus and cingulate sulcus. At 29 weeks, the central sulcus begins to develop, and you can see the pre and post central gyri. We have the quadrigeminal plate, which we've discussed earlier with the aqueduct of Sylvius. We have the calcarine sulcus and the parieto-occipital sulcus, which run together anteriorly. The marginal sulcus, coming from the cingulate sulcus as you move posteriorly, contains branches of the callosal-marginal artery, and the marginal sulcus forms a landmark for the central sulcus, which is the next anterior sulcus and sometimes hard to find later in pregnancy. After 28 weeks, the sulci of the frontal lobes begin to develop, and there are 3 lobes, as you can see, 3 gyri of the frontal lobes. And the temporal sulci also begin to develop, and here you can see the superior and inferior temporal sulci. Now let's test your knowledge of what we've just talked about. This is a woman who came in at 27 weeks. It was a routine scan for fetal growth. And here's a clip. And what I would like you to do is to look at these images and see if something catches your eye or you understand what might be going on. This is a different case with very similar findings at 29.5 weeks. The patient had a 28 weeks fetal MRI, and that is useful for correlation. Now I'm giving you a normal scan for comparison. Look at the development of the sylvian fissure and contrast that with the minimal indentation of the sylvian fissure in these 2 abnormal fetuses. This is the post-mortem scan showing the minimal development of the sylvian fissure. This is a case of type 1 lissencephaly. So in conclusion, the coronal plane is a useful way to view brain anatomy. As we've seen, sulcation proceeds very rapidly in the 3rd trimester. Sulcal development can be used to estimate gestational age, as well as brain pathology, and fetal MRI anatomy definitely assists us with anatomy seen with ultrasound. Thank you very much for your attention.